Hà Lan xin chào tất cả quý khán giả. Xin cảm ơn quý khán giả đã quay trở lại và đang theo dõi buổi tọa đàm về sức khỏe ngày hôm nay. Xin chúc tất cả các bạn một ngày mới thật tràn đầy năng lượng và an lành. Buổi tọa đàm hôm nay được thực hiện bởi Regent Health, là một trong các buổi tọa đàm về sức khỏe của chúng tôi. Tại Regent Health, chúng tôi mong muốn chia sẻ những kiến thức quý giá để tăng cường, bảo vệ sức khỏe và là cầu nối kết nối bạn với các chuyên gia y tế tại Việt Nam cũng như Singapore để cùng đưa ra sự tư vấn về y khoa phù hợp nhất với bạn. Hiện tại tháng 10 là tháng về nhận thức bệnh ung thư vú và Regent Health hân hạnh được mời tiến sĩ bác sĩ Sulo chia sẻ về chủ đề về bệnh ung thư vú, cụ thể là liệu pháp miễn dịch có phải là một lựa chọn điều trị cho bạn hay không. Bác sĩ Sulo hiện là một bác sĩ chuyên khoa ung thư rất giàu kinh nghiệm trong nghề và là chuyên gia tư vấn thăm khám tại ung thư tại Trung tâm Ung thư Quốc gia ở Singapore. Và bây giờ chúng ta hãy cùng chào đón tiến sĩ bác sĩ Sulo. And now please welcome Dr. Sulo. And would you like to tell us a bit about yourself?
Hi, thank you for having me. My name is Dr. Sulo. I am a medical oncologist and I was trained in the UK and I joined Singapore National Cancer Center way back in 2008 where I look after a lot of breast cancer patients. And I then started my own private practice at Mount Elizabeth Novena in 2013 and I've been running my practice until today. So my main interest is looking after breast cancer patients and I'm a medical oncologist. That means I give systemic therapy, which I will elaborate later.
Yeah, thank you, Dr. Sulo. And now let's move on to the answer the question that the audience is interested in. And please tell us about what is breast cancer.
Yes. So breast cancer is a type of cancer that arises from the breast tissues, which is in our breast. So it is very common in women. 1 in about 10 women in Singapore can get breast cancer in their lifetime. Although it's mainly in women, we will also find it in men, although it's much rarer. So 1 in 100 men may get breast cancer in their lifetime. So the message is that breast cancer is common. It can affect anybody, including men. So we must look after our breasts.
Yeah, thank you, doctor. And what's the treatment available for the type of breast cancer the patient have?
Yes, so there are many types of breast cancer. So the breast is one organ, but in that organ, many types of tissues can, there are different types of cancer that can form in the breast. So about 80% of the breast cancer is adenocarcinoma. And of this 80%, we would roughly divide them into hormonal positive or receptor positive. So then the treatment options will depend on what sort of subtype breast cancer there is. And the treatment can be divided into local, which is targeted at the breast, or systemic, which is we give drugs that circulate in the whole body to go all over the body to capture any cells that might be circulating in the body. So local treatment is usually done by the surgeon and by radiotherapists. So surgeons will do surgery to remove the breast or the lump in the breast, and radiotherapy is to complement surgery, which if there were any cancer cells left in the breast, radiotherapy can target the whole breast area and kill off any remaining cells. My specialty is based on systemic, that is to take care of the rest of the body. So then the type of treatment that I would offer depends on the subtype of cancer. If they were hormone positive, then we have hormonal therapy drugs. These are usually given orally. And there are many types. There are the old types, which is called tamoxifen, which many of you might be familiar. And the more recent ones is the aromatase inhibitors, which is also a hormone therapy. Latterly, the last 4 years, we have very successfully been treating patients who are on hormone therapy, but we give another targeted therapy that will increase the efficiency of the existing hormone therapy and also prolong the patient's life. That is hormonal therapy, mainly given by oral tablets. Then we have systemic therapy by giving intravenous chemotherapy, which is a very old, the original type of chemotherapy, original form of treatment that kills off bad cells, the cancer cells. So the cancer cells are the ones that divide very rapidly. Chemotherapy is designed to capture all these very rapid growing cells, but they also affect the good cells. So the good thing is the chemotherapy will kill off the bad cells, which will stop them from coming back, but the good cells that have been killed off will recover. With time, they will get back to normal. Then recently we also have immunotherapy, which some of you might have heard of. This is unlike chemotherapy. Chemotherapy are toxic and kill off any cells that they come across with. Immunotherapy is a form of therapy that activates our on-body immune system to go and fight the cancer cells. As a result, the side effects are very little, but not usual. But when they do happen, it can be quite severe. And sometimes when the immunotherapy is too strong, it activates our on-body system to also target our good cells in the body, such as in the thyroid. It can cause thyroiditis, inflammation of the thyroid, so the thyroid function may not be very good, or it can affect lungs function, inflammation of the lungs, and the patient will present with cough, breathlessness, or coughing up blood, or attack the colon, causing colitis. So patient will present with diarrhea or bloody diarrhea. So these are very severe form of side effects, although not very common. We do watch for it very, very closely. Also, we have targeted therapy. These are the treatment that we would look at the cell surface of the breast cancer if they have particularly a HER2 receptors. We have many targeted therapy that targets these HER2 receptors. And because the treatment is to target the cancer cells with these targets, the good cells in the body that do not have these targets will not be affected. As a result, patients will tolerate this very well. So when we have a target for the treatment to target at, treatment usually is very successful, and patients can be on it for a long time and they remain well and alive for a long time.
Yeah, thank you, doctor. And the next question is, how will the patient know if the treatment is working? Yeah,
sure. So depends if the patient still has the breast lump in the breast. When the treatment starts to work, the lump would become smaller and become softer. And quite often the patients will also describe to me that they feel a bit of shooting pain in the lump. So this is quite a common phenomenon, and usually is to do with the cancer cells dying and the tumor shrinking. This is if the cancer is confined to the breast. But sometimes if cancer has spread to the lungs, to the liver, to the bones, then the symptoms that were caused by the original cancer would get better. For example, if the cancer cells have spread to the bones, then patient might experience bony pain, or they may have fracture because of the cancer cells invading the bones, causing all this bone not to function well. So the bone pain will improve if the treatment is working. Also, if it's in the lungs, patient may complain of cough, breathlessness, or coughing up blood. Again, all these symptoms will improve when treatment works. Similarly, in the liver, if it goes to the liver, usually patient may complain about pain in the tummy, or not having any good appetite, or they might be jaundice or yellow in color. So all this will improve as well with treatment responsive, killing out the cancer cells. But that is how patients feel. We clinicians, we will also do scans. So in the blood test, the tumor markers, when the cancer is active and very big in volume, the tumor markers will be high. So the numbers will come down or even go back to normal if the treatment is working very well. We will also do scans looking at the lungs, the livers, the bones. Again, these cancer cells will die off when the treatment works well.
Yeah, thank you, Dr. Sulo. And the next question is, how can the patient make sure they have the best quality of life possible?
Yeah. So the culture in the Far East is very good. We usually have very good family support. So patients should get plenty of rest. But by resting, I don't mean just lying in bed, but although patients will be tired from the treatment, they are able to function as their usual, such as if they were usually going out for walks, if they do enjoy cooking, they can still do those activities, but it may be that they do become tired more easily. So most important is to not let the cancer take over your life or the treatment take over your life. We always work in conjunction with what patients can do and want to do. I have patients who continue to work even because the treatment nowadays, we can really give targeted therapy with little toxicities, and we have a lot of good supportive medicine to help them maintain their life as normally as they can. Generally, treatment we give, for example, chemotherapy is given once every 3 weeks. The first week, patients tend to be more tired and not have such good appetite, but second and third weeks they usually are quite well. So then the advice would be the first week of treatment, they should try to rest, drink plenty. If they don't have appetite to eat, just make sure they are well hydrated, because the second and third week, the appetite will come back and they will regain their energy and their appetite. So important to keep active. Just gentle walkings daily, twice a day would be useful. We don't expect patients to run or swim or do any vigorous exercise, but important to keep active. Eating healthily is also important. So first week when they don't have appetite, it's important to drink plenty. Second, third week, try to eat as much fruits and vegetables and fresh produce as possible. Family support also very important. Like I say, the family in the Far East are very supportive and they are always there for the patients. So they act as physical support as well as emotional support. And also when we treat cancer patients, we see them very frequently, sometimes once a week, sometimes once every 3 weeks, depending on how well or how unwell the patient is. We do form a very good rapport, and clinic nurses are very important part of the support team as well. Usually the first 2 visits when patients come, they are apprehensive, and it's very traumatic to receive news that they have cancer. But when you have a group of familiar, expert doctors, nurses who are professional, that would make the journey with their treatment journey much easier.
Yeah. Thank you, Dr. Sulo. And the last question is, what should the patient do if they feel stressed or depressed? And please give your advice to the audience here about protecting health as well as the treating for this disease.
Yeah. So yes, having a diagnosis of cancer is devastating. So it's absolutely very normal for patients to feel depressed, stressed, or it is such a big life-changing event. But with the treatment that we have, with the expertise that there is, we really would like to emphasize, especially for breast cancer, there's a lot of treatment options, and a lot of patients with the right screening and having cancer detected early, they will be cured. 80-90% of patients detected early stage will be cured. So that is something we need to emphasize and try to support them. But we do not take it trivially that, oh, you will be fine. So it is a very difficult journey to go through. But so having lots of rest, having exercise, having family support, talking to the doctors, to the healthcare profession, hopefully will help the journey easier. But there will be times that patients will feel depressed, stressed. That is very acceptable, and just seek help from the medical professional who have looked after so many patients and know how they feel and can hopefully help them through the journey more easily.
Yeah. Thank you so much, Dr. Solo, and for joining our talk show today. Yeah.
Thank you for having me.
Yeah. Hà Lan xin cảm ơn quý khán giả đã theo dõi buổi tọa đàm sức khỏe của Regent Health ngày hôm nay. Hy vọng là chương trình đã mang đến những thông tin thực sự bổ ích cho quý khán giả về bệnh ung thư vú, cũng như là về liệu pháp miễn dịch cho căn bệnh này. Xin chúc quý khán giả và gia đình luôn luôn mạnh khỏe và bình an trong cuộc sống. Và hãy liên hệ với Regent Health để được tư vấn cụ thể hơn về phương pháp điều trị cho căn bệnh này. Và Hà Lan xin cảm ơn và xin chào tạm biệt.